and today we're talking about kidney disease and diabetes, 5 ways sugar can be crippling your kidneys. I'm a board-certified kidney doctor, and so I can tell you firsthand that diabetes is the #1 cause of kidney failure. And we all know that sugar is a big concern these days, especially if you have diabetes. But do you know what it is actually doing to your kidneys every single day? It's not an overnight event, no. It's actually a quiet process that can be occurring over years. In this video, I'm going to give you 5 ways that sugar can seriously be damaging your kidneys. My goal is to give you the knowledge you need to protect yourself. I'm going to do this by looking at 5 stages of change. We'll talk about how your kidneys can be overworked and worn out. And then we'll talk about how this overworking can actually lead to permanent scarring of your kidneys that in some cases cannot be reversed. We'll also talk about the #1 sign that your kidney filters are leaking, which is a problem. We'll talk about how sugar can clog your pipes, how it can clog your blood vessels in your kidneys, which can cut off proper blood supply and oxygen. And we'll also talk about the sneaky way that diabetes can affect your bladder, which can hurt your kidneys. After watching this video, you'll not only be scared of sugar, you'll be smarter than it. And you'll be able to talk to your own doctor with more confidence, and you'll understand what's really on the line when it comes to kidney disease and diabetes. You'll also have the drive to make changes in your own diet so that you can be healthier in the long run. #1, the overworked filter, hyperfiltration. Think of your kidneys as having millions of little delicate filters, and their responsibility is to clean out your blood, right? To filter your blood. Well, when you have excessively high amounts of sugar in your blood or hyperglycemia, then this causes the kidneys to have to work harder and go into overdrive in order to filter. This is called hyperfiltration, and so it overworks the kidneys. If you compare your kidneys to a coffee filter, for example, everything is fine when the coffee filter just has a normal stream. But if you were to take a big old fire hose and put all that pressure on the coffee filter, it would cause the filter to stretch, to be distorted, and to not work properly. This is what happens when your kidneys are constantly exposed to high sugar. They go into overdrive from the hyperfiltration, and you actually damage your kidneys. So here's one thing you can do. First thing in the morning, start off with a glass of water, perhaps a glass of warm lemon water. When you drink the water, this is one way to help to support your kidneys filtering. And then, of course, you want to make good choices when it comes to sugar throughout the day. When it comes to lab work, ask your doctor for your eGFR, estimated glomerular filtration rate. This lets you know how well your kidneys are filtering. But remember, we're talking about hyperfiltration early in diabetic kidney disease. And so your eGFR might initially not only appear normal, it might be high or hypernormal. This is not necessarily a good thing. It could be a sign that your kidneys are being overworked and that there's hyperfiltration. And so make sure you follow this eGFR with your doctor over time to see what's going on with your kidneys. Ultimately, you want to make good, smart food choices, like eating foods with lots of antioxidants, like blueberries, strawberries, raspberries, spinach. This is another way to support your kidney filtration. Would you like my undivided attention as we discuss your specific medical journey? If so, you are in luck because I offer a concierge telehealth service where you can get my direct input on your health concerns. Be sure to click the link below. #2, permanent scarring or glomerulosclerosis. So these kidney filters you have are called glomeruli. And if they're overworked over time, then they can be damaged and be scarred, which is the glomerulosclerosis. So yeah, all that hyperfiltration and being overworked over time, it can cause scarring. Just like your skin. If your skin has injury, you get scars there. If you think about that coffee filter example, imagine if the coffee filter gets little points of dried glue. If somebody puts glue on it. Well, in each point where you have the glue, then the coffee filter won't filter very well, right? It'll be stiff and it really won't be helpful. So over time, if someone put more and more little bits of glue on that coffee filter, then the ability of the coffee filter to filter would get worse and worse, okay? This is what happens to your kidneys. Over time, after they've been overworked by having to filter out your high blood sugar, eventually you get scars and more and more and more glomeruli, and that actual scarring, the glomerulosclerosis, is unfortunately not reversible. That's why you want to stop it early on and try to do things to reduce the kidney damage before it gets to the point of scarring. So here's one step you can take. After you eat your biggest meal of the day, just take a 10-minute walk. This will help your body to use the glucose in your body more efficiently. It will help to prevent you from having such high blood sugar or hyperglycemia, and this can cause less damage and ultimately less scarring to your kidneys. As far as lab work, again, you want to ask your doctor about your eGFR, that estimated glomerular filtration rate, because by the time you get to the point of having kidney scarring, that eGFR will be low. For example, if your eGFR is less than 60 but greater than 30, then that is CKD stage 3, chronic kidney disease stage 3. If your eGFR is less than 30 but higher than 15, then that is CKD stage 4. There are 5 stages of chronic kidney disease. Be sure you watch my video on CKD stages after you finish watching this video. As far as smart food choices, try to incorporate foods that have healthy fats like avocados, olive oil. This is a way to help to reduce the inflammation in your kidneys, and we know that it's the inflammation that can ultimately lead to permanent kidney scarring. Number 3, the leaky filter, proteinuria. So we've already talked about how when you have high blood sugar, it can overwork the kidneys, cause hyperfiltration, and lead to kidney damage. If you get a lot of kidney damage or scarring, that can lead to glomerulosclerosis and a decline in your eGFR. Well, another thing that can happen with damaged kidney filters is that they can leak. And what they leak out can be important proteins like albumin. If you think of your kidney filters like screens, okay, like a screen on the door, well, that screen is meant to keep bugs out, right? But if you get rips in the screen, if there are tears that make the little fine holes bigger, well, then the bugs will start to get in, okay? Well, the albumin or the protein is like the bugs, and your kidney filters are like the damaged screen on a door. So here's one thing you can do to help to decrease the leakiness of your kidney filter. Well, manage your blood pressure. And one way to do that is to have a low salt diet. According to the American Heart Association, most adults should have no more than 1,500 milligrams of sodium or salt a day. If you have high salt in your diet, it tends to make you hold on to fluid inside of your blood vessels. And the more fluid you have in those blood vessels, the higher pressure on those blood vessels, leading to hypertension or high blood pressure. Well, if you have high blood pressure in the vessels in your kidneys, in those kidney filter vessels, well, that high pressure will make you push out more protein, okay? In other words, if you have an uncontrolled high blood pressure in your kidney filters, that pressure causes your filters to leak more. So having a low salt diet by being a label watcher is one way to decrease proteinuria. Do you have any questions about kidney health that you'd like me to cover in another video? Please comment down below. If you suspect that you have a leaky filter or proteinuria, the lab you should ask your doctor for is a UACR, or a urine albumin to creatinine ratio. This will allow your doctor to pick up whether or not you are leaking albumin, that protein, into your urine. And if you are, then it can inform your doctor of what steps need to be made to decrease the leakiness of your filter and to help to slow down the progression of diabetic kidney disease. Oftentimes, we're able to pick it up in these tests way before you ever see any signs of having a leaky filter. And a sign of a leaky filter or proteinuria is foamy urine, foamy or bubbly urine. Make sure you watch my video on foamy or bubbly urine after you finish watching this video. If indeed you do have a leaky filter, here are some smart food choices. Make sure that you eat lean proteins like beans, fish, the white meat of chicken with no skin. It is important that you maintain a certain amount of protein in your diet, but it needs to be the right protein and the right amount. If you have too much protein, then that's something that could worsen your proteinuria. For patients with advanced kidney disease, oftentimes we recommend anywhere from 60 to 80 grams of protein a day. Make sure you consult with your doctor and your registered dietitian to know the amount of protein that's appropriate for you. Question: after watching this video, what is one small change you are ready to make today to cut back on sugar? Please comment below.